Hi, I'm Dr. James Zurich. I'm the Director of Mental Health here at Tamworth Mental Health Service, and I'm here with Dr. Lauren Taylor, who is our consultation liaison psychiatrist, and we're here today to talk about the Mental Health Act. Hi Lauren.
Hi James.
Thanks for joining us here.
It's a pleasure to be here.
So the Mental Health Act is the main piece of legislation that covers the assessment, treatment and rights of people with a mental illness. Lauren, I was hoping you could tell the JMOs here how someone would come into treatment under the Mental Health Act.
Great question, James. And really, as you said, the Mental Health Act is a really important piece of legislation. It protects doctors in their removal of someone's right to freedom of movement. So it's really important that we get this right as doctors, because it's a very important and significant responsibility to have to be able to remove someone's right to freedom of movement. So the ways that people can come into or under the Mental Health Act, and most commonly for the JMOs, it would be the patient who is scheduled in the emergency department. And even if we go one step back, and I guess we can consider and think about how someone might come to be scheduled.
Absolutely. Could you first of all tell us a bit about what a schedule is?
Absolutely. So as we kind of mentioned, a schedule is really the first step in the process of the Mental Health Act. So a schedule is a legal document that essentially says that the doctor is so concerned about the patient that they are requesting a further psychiatric or mental health assessment. Now, in order for a patient to satisfy the criteria to be scheduled, there are some very strict criteria that have to be met. And really, they are that the person has a mental illness, that there are significant risks that are arising because of that mental illness, and also that there's no less restrictive way of providing treatment, care and control for that person. So if we think about that even further and break it down, in order for someone to have a mental illness, the Mental Health Act defines that by a few criteria. Firstly, that the person is suffering from hallucinations, or from delusions, or from a severe disturbance of mood, or from severely disordered thought form, meaning that their thoughts aren't connected logically, or that their behaviour is so irrational or bizarre that it's reflecting the presence of these other symptoms. So when you're considering whether to schedule someone under the mental illness provision, they're the three key things that you need to be satisfied of yourself before filling in a schedule. So to recap that, that's the presence of a mental illness, that there's significant risk arising from that mental illness, and that it's a reasonable person would see that there is risk arising, and that other less restrictive treatment options are just not available. So the person's not agreeing to remain voluntarily, and there's no other way that you can access or conduct further assessment unless you utilise the schedule.
Lauren, is there anything else we need to do after a schedule's been filled out?
Yeah, it's a good question, James. So once a scheduled patient arrives at a mental health facility, it's really important that they're given their statement of rights, which outlines their rights under a schedule and under the Mental Health Act.
Okay, so if a patient with auditory hallucinations, say persecutory delusions, who had assaulted their mother because they thought their mother was evil, who had a history of aggression towards their family members when they were experiencing a relapse of symptoms of schizophrenia, and if they were refusing to remain in hospital and lacked insight, I would then choose the mental illness option.
That's exactly right.
Okay.
So given the presence of perceptual disturbance, of hallucinations in this individual, and their paranoid delusions, they're meeting the mental illness criteria. You've highlighted that there's significant physical risk of harm to this patient's mother through aggression, and they're not agreeing to remain voluntarily. So yes, in that situation, that patient would meet criteria for the mental illness provision on a schedule.
Okay. Now I know on a schedule there's also provision for mentally disordered.
Yes.
Can you tell us what this means, being mentally disordered?
Yes, and really when we get down to it, when you're in the emergency department and there's a patient who you're concerned about, who's presented with mental health concerns, probably for the JMOs, this will be one of the kind of points of uncertainty, is whether to choose or tick the mentally ill box or the mentally disordered box. So I'm really glad that you asked that question and that we can talk about that. So mentally disordered under the schedule really does not require the presence of the criteria that we mentioned that are necessary for a mental illness. What the mentally disordered provision requires is that the person's behaviour is so irrational that it is reasonable to conclude that the temporary care or control of that person is required in order to prevent imminent physical risk to themselves or to somebody else. So the keys really with the mentally disordered are that it's about behaviour being extremely irrational, that again there's no less restrictive way of managing this, that it's reasonable to see that significant physical risk either would be caused to that person or to somebody else if they were not scheduled as mentally disordered and I guess held within hospital for further psychiatric assessment. Does that make sense?
It does. So Lauren, a schedule's a document that essentially allows a patient to be involuntarily transported to a gazetted unit for further assessment. And here in Tamworth, it's the ED.
That's exactly right. So a schedule really is like, in some ways, a transport document, and it's also a document that's saying further mental health assessment is needed.
Okay, wonderful. Now, I know that there are several ways that a legal request for a mental assessment can be made, and there are different sections.
There are.
Could you tell the JMOs the difference between them all?
Yeah, absolutely. So it can be a bit bamboozling, I think, the number of different sections that there are, but the key ones really, the key point really is firstly that all of these sections are fulfilling the same purpose of being the transport document to a gazetted facility to enable further mental health assessment. So the schedule is actually otherwise known as a Section 19, and that's what the Section 19 looks like. That's the schedule. Now, there are also Section 20s, and Section 20s can be filled out by ambulance officers in the community if they have significant concern, really meeting the same criteria that we've already covered, and they need to transport the patient to a facility to enable mental health assessment. Now, Section 22 is the document that police officers use in the community to transport people to enable further mental health assessment. And then finally, for our purposes today, there are Section 33s, and they can be filled out by a magistrate requesting and facilitating transfer of a person who is appearing before a magistrate to request further mental health assessment.
Great, thanks for clarifying that, Lauren. Tell me, what happens after a patient is transported to a gazetted area. So a schedule's being filled out, and then the doctor in emergency needs to make a call whether to uphold the schedule or not.
Yes. So a really important part of the Mental Health Act in protecting the rights of people who are detained under a schedule is that the review, the further mental health review, must happen within 12 hours of the schedule being completed. I think this is a point that sometimes gets lost in the busyness of clinical work in emergency departments, or particularly when patients maybe are transferred to general wards. So it's really important to bear in mind that 12-hour requirement. Otherwise, that schedule will actually not be legal. So really a doctor needs to conduct a further mental health assessment, and they need to be satisfied really of those same criteria that we've talked about. So the presence of a mental illness, significant risk, no less restrictive treatment option that is available, in order to uphold the schedule. And by upholding the schedule, that doctor would fill in what's called a Form 1. The other name for a Form 1 is the first Form 1 is a Section 27A. So, you know, there's lots of terminology, but the really critical thing is that the mental health review occurs within 12 hours, and that to uphold the schedule, as mentally ill, those criteria need to be met. To uphold the schedule as mentally disordered, the person's behaviour has to remain so irrational that physical risk would occur if you did not uphold the mentally disordered schedule.
So I guess it's quite important to realise that a schedule and a Form 1 or a 27A have to be done by two different people.
Yes, absolutely.
Okay.
Yes.
Once the first Form 1 is complete and the person is detained under the Mental Health Act, what happens next?
Yeah, so the next step in the Mental Health Act is that then another mental health review needs to be conducted, and this time it actually needs to be by a psychiatrist. So a psychiatrist needs to do a detailed psychiatric assessment and to reach a conclusion themselves as to whether the person is satisfying criteria for involuntary treatment, either through the mental illness or the mentally disordered provision. Now, the timing of that, the Act talks about that happening as soon as is practicable. So the important thing for JMOs on the ward is to make sure that the CL psychiatry team is aware if there is a patient who has been scheduled and has a Form 1, to make sure that psychiatrist review can happen.
Great. Thanks, Lauren.
Yeah, and then I guess, James, I'll just add, after that, the person would be what we'd call an accessible patient. And again, the terminology is not the most important thing, but the process is important. So the process then would be that patient would come before the Mental Health Review Tribunal, who then provide checks and balances to ensure that the Mental Health Act has been enacted appropriately, is being utilised appropriately, provides the person who's being treated under the Mental Health Act with an opportunity to express their views and have legal representation as well.
Thanks, Lauren. And thank you for your time. I hope you found this interesting and helpful. If you'd like more information, please refer to the website below. And also, please feel free to come and speak to Dr. Lauren Taylor or myself.